Good morning, good afternoon, good evening, depending on where you're joining us today from. Thank you for attending today's webinar. Welcome to UC San Diego. Congratulations on your admission to UC San Diego on behalf of the International Services and Engagement Office. Today's webinar is on student health and incoming health insurance and requirements. Next slide, please. So my name is Marie Monlapaz Rivera. I'm the Assistant Director for International Student Services at the International Services and Engagement Office, also known as IACO, and I'm joined with our campus partners and Student MediCorps, and I'll have everyone just go down the line and introduce themselves.
Hello all, my name is Jill Batika and I'm the Insurance Billing and Medical Records Manager at the Student Health Clinic right on campus. I'll hand it off to Annie Horton.
Thank you, Jill. My name's Annie Horton. I'm the Director of Nursing at Student Health Services and oversee the incoming health requirements. And hand it over to Lumen.
Hi, hello. My name is Lumen Yan. You can call me Bella. I'm also a proud UC San Diego Triton alumni. So it is really meaningful for me to speaking to you all today.
As you can see, we have a great group of presenters, and today's agenda will be going over first steps, checklist reminders, student health services, also known as SHES, incoming health requirements, our upcoming webinars, and an opportunity for Q&A. Next slide, please. So just a few logistics. Note that you are in listen-only mode and you can hear us, but we can't hear you. The way we'll be interacting with you is with our Q&A feature. You can submit questions there. And then note that these webinars will be recorded and you'll be able to access them at inewstudentwebinars.ucsd.edu. No, it is taking about a week or two for us to get these up online, but you'll be able to access this information. So here's the control panel where you'll be able to ask your questions. We'll have some time at the end to answer your questions, and the panelists will stay on to interact and answer your questions through this Q&A feature. Next slide, please. So meet ISCO, just a few introductions to our office and the services we provide. Our team of expert staff supports and guides international students and scholars with their academic and personal goals, successful transition to campus and student life, and a meaningful engagement with the university and local community. We're so excited to have you be joining us, our Triton community, very soon. So some of the services that ISE provides are our pre-arrival and orientations webinars, such as the one you're attending today, advising services virtually and in person, visa and status support services, and a variety of different programs and events to build a culturally international community that is engaged with the community and the campus. So about the populations we serve, ISEO serves over 10,000 international students that are enrolled and working after graduation, and we have an international faculty scholars, over 2,000 scholars that are either working or conducting research at UC San Diego. And our international families, we have over 1,000 that are joining our international students and scholars, and then our campus partners that we can't do this work alone without their help, serving the different departments. We serve just under 14,000 international students and we are number 8 as a leading institution for hosting international faculty and scholars. And we're number 15 as a leading institution for hosting international students. So who are students? Next slide, please. Our favorite part. So we have over 8,000 international students that may be enrolled and working after their graduation. So it's pretty evenly split between 4,000 undergraduate students and 4,000 graduate students. You can see the popular different departments that our students are studying and the places of origin. We have students coming from over 100 countries. So welcome on behalf of ISCO. We're very excited to welcome you soon. We know that the journey is not easy to get here, but we're very excited for you to join our community and looking forward to the opportunities where we can engage one another and learn from each other, and how you'll add so much to our campus community. Okay, first steps checklist. Next slide, please. So the first thing you'll need to do is log into your applicant portal and complete your enrollment checklist if you have not done so already, by accepting your offer admission, and then 2, completing your California residency for tuition purposes questionnaire. So if you missed the first webinar, you can go to inewstudent.ucsd.edu and find out more information on the next steps to request your I-20 or DS 2019 and go through the process. We made it pretty easy for you to go through the next steps. So now I'll be handing it off to Annie to talk about incoming health requirements.
Thank you so much, Marie. So I'm going to be talking to you about the UC San Diego incoming health requirements. So these are vaccinations and tuberculosis screening that we have all incoming students complete. And I just want to congratulate you on accepting your position with UC San Diego. We're really excited that you're going to join us. And I really want to make this process as straightforward for you as it possibly can be. Next slide, please. Why we have incoming health requirements, and these requirements are for all of the University of California's right throughout our state, and they help protect our community from vaccine preventable diseases. We are seeing outbreaks, unfortunately, locally and globally with vaccine preventable illnesses such as measles, mumps, chickenpox, pertussis. So we're really invested in ensuring that everybody is protected as possible, because we know these outbreaks are very disruptive to your studies, and so we really want to facilitate your time through the university with as little illness as we possibly can. So what are the health requirements? So they are tuberculosis screening, and if you're coming from countries outside of the US, that is likely to also include testing. And then we have our core 4 vaccines, which includes Tdap, which is tetanus, diphtheria, and pertussis. And the piece in this combined vaccine that we're wanting to prevent is pertussis. It's also known as whooping cough, and it's spread through coughing in congregate or group settings, measles, mumps and rubella, varicella and meningococcal. And we have our deadline set around July 14th. And then when you're here, during the fall and winter, we also require the COVID vaccination and the influenza vaccine to reduce our incidence of respiratory illnesses. So I just want to say that everything that is in my conversation here with you today can be found on our website, and we have a student health website and the link is there, and if you go to the health requirements page, everything is there: our forms, our due dates, our hold dates, and anything that you could possibly have a question about, you can also find here. So starting the process. So once you have your UCSD student AD login, which is a UCSD email and password, you will be able to, and we also download you into our system, which happens around May 1st, depending on when you accept. You will want to go into our electronic health record, which is called EPIC, and the your piece that you can see is called My Student Chart. So you are already assigned a My Student Chart, but it does require that you go in there to activate it, and I would encourage you to do that as early as you possibly can. That way I can send reminders and information, and you can communicate with us around this process. And all of this information can also be found on your incoming Triton checklist, and a link into My Student Chart. Our website also has links into My Student Chart on every page to make it as easy as possible. Next slide, please. So this is what I'm talking about, Triton checklist, or the enrollment checklist, and it will have the outlines and the links that you need to cover this whole process. And this is just an extension of that covers the COVID-19 and flu vaccines. So this is what, before you log into My Student Chart, this is the page that you will receive. And it's just, I really wanted to highlight this so that you know to go in through the sign-in that utilizes your student AD login, not the username. So the username or the new user, those are for UC San Diego Health patients, not necessarily students. So if you want to see and you need to see all of what's required of you as a student, you'll be going in through this part of the portal that utilizes your student AD login. So when you get in there, this is what you're going to see. And basically, you can access everything for this process through the menu. And you'll be going to a couple of places. One place is immunizations and screening, and the other place that's not shown here is COVID-19. And the really good part about going into the COVID-19 is if you do have any records here in California in our registry, it will pull in old vaccines and actually TB testing into your chart for you, which will reduce the amount of work you need to do. So if you go there first and then come to the immunization and screening page. So this is where you will see both of the requirements, and I would encourage you to really get onto this as soon as you possibly can and start with TB screening, because the deadline or the whole date for TB screening is before you start school. So it's a very good idea to make a start on this. And there are a series of questions, and then you do those screening questions, and then the next step is determined by risk. So if you have one or more risk factor, then you are also going to be requested to test. So you will take that testing form to your healthcare provider for them to provide testing. And then the next section is on immunizations, and this is where you're able to enter your dates of your vaccines and also any blood tests or lab titers, which tests for immunity, if you need to get those instead of having actual immunization dates. So the immunization requirements, so you're going to be getting your records. So that's really a good place to start, so that you have all of the accurate dates for these vaccines if you've found them, if you've had them in the past. If you need guidance or your healthcare providers need guidance, there is a form that you can find on our website that goes through all of the vaccines that we require and the ones that we strongly recommend, and it gives you the exact information. For example, the varicella or the chickenpox vaccine requires that your first dose is on or after your first birthday, and that there needs to be 30 days between doses. So all of that information can be found on the form. Take that to your healthcare provider, because it will definitely guide them as to what we are needing, and then you can use that form, or if you have really good records of your own, you can use that to enter those dates into my student chart. So this is what it looks like in My Student Chart. You can hover over the little info bubbles and it will give you additional information. There are more spaces than required vaccines, just in case you've needed to have boosters or you have more dates than what is required and you want to enter those, which is totally fine. You can enter those dates in. The system has some inbuilt intelligence into it, and it will accept dates, but on our end it will tell us if you achieve that requirement or not, in terms of if you meet the rules. For example, with MMR, there needs to be 30 days in between. So if you have not received, if you've received it too young or too early, we'll be able to see on our end and give you information around that. So the two seasonal vaccines that we require include COVID-19 and influenza. So in the US, your early doses, you are welcome to put them in, those very first doses that we all got through the pandemic, but they aren't the ones that will make you compliant. What we want is for you to have an updated dose of the most common strains, and that will be available in the US in the fall. So this is not likely something that you'll get before you come to school. unless you've had some sort of remarkably early access to these vaccines, generally speaking, that you'll be able to get these if you have our student health insurance or UC SHIP. You will be able to get these covered, and we have mass clinics that run all year, and you'll be able to easily come in and get those vaccines. Or most insurances cover retail pharmacies in the US, which are able to also give vaccines very easily, and you can book and get those there too. And they are very safe to be given together at the same time, and it's a great way to remember to get these both done. Good idea before the flu season hits, so early fall is a good idea. So the TB, as I said, risk is determined by the screening questions, and the types of tuberculosis testing that we accept include the TB skin test, and that's sometimes called PPD or a variety of other things. That is accepted where you get a little bit of tuberculin injected under the skin, and then that is read either 2 or 3 days after to see if you had any sort of local reaction to that. That might be something you've had before and are familiar with. The other option is the blood test, which is the one we really recommend, which has a couple of different brand names. It can be called quantiferon or T-spot test, depending on where you're coming from. And that is a test that takes 3 to 5 days to result, and it's the most accurate way of determining past exposure to TB or current issues with tuberculosis. But as you're absolutely welcome to get these other forms of testing. But if a quantiferon is an option, that we would highly recommend that. A chest x-ray is also acceptable. If you get a chest x-ray, though, during the school year, we will be recommending that you get a quantiferon. Chest x-ray tells us the current state of your lungs. It doesn't tell us if you might have something called it latent TB infection, which is it sort of sits dormant in the bloodstream and it can convert to active TB during your lifetime. So we really want to know whether you may have that currently, and we would recommend you get treated while you're in school for that. Now the testing, TB testing, we need you to have had that within the previous 12 months prior to coming to school. So within that year before coming, prior to that, we would consider that out of date. You would return to My Student Chart and upload that testing form, and that will come to the nursing team. Now, the nursing team will be communicating with you whether you've in fact met the requirement or something else might be needed. So please check back into My Student Chart on a regular basis. Set up notifications so that you get a text or email when we've sent you a message, so that you don't make the mistake of not realizing that you don't quite meet requirements and an academic hold is placed on your account, which prevents enrollment in classes. So that's really the consequence of being not completing these requirements on time, and we want to avoid that if we can. In terms of getting help, within My Student Chart, we have on that menu, there is a section called Ask a Nurse, and that comes to myself and to my team of nurses, and we answer those pretty much within 24 hours. Sometimes perhaps if it's a holiday weekend, it might not turn around quite that quickly. And around those deadlines and hold dates, the volume of messages gets pretty high, but mostly we will be able to get back to you within 24 hours. And you can ask us any questions at all. We do have an email there that is only for technical difficulties. If you're having trouble getting into My Student Chart or some other just technical, please don't send any health information through email, because we know that that's not a safe way. Whereas through our electronic medical record, it is secure and safe to send your personal details. If you have questions, please check our website first. Many of your questions will be answered there. There's lots of detailed information about the specific vaccines and vaccines from all around the world. So if you're looking at your vaccine record and you're not sure what that is, that website may be able to guide you as much as possible. And we really just want you to attend to these requirements as soon as you possibly can to avoid any academic disruption. And I will now hand this over to Jill. Thank you so much. And please message us if you have any additional questions.
Thank you, Annie. Hello all, so happy to be here with you to share some information on our campus health insurance requirement. So what is UC SHIP? Well, health insurance is essential in the United States because healthcare services can be very expensive without it. Even routine medical visits, prescriptions, or urgent care services can result in significant out-of-pocket expenses. More serious medical situations such as hospitalizations, surgeries, or emergency treatment can cost tens of thousands of US dollars. Health insurance helps protect individuals from these high costs by covering a large portion of medical expenses and ensuring access to necessary healthcare services. In order to protect students and our campus, the University of California Office of the President has mandated that all students have comprehensive health insurance while attending our campus. To do this, they instituted SHIP, which is an acronym for the University of California Student Health Insurance Plan. This plan is only sold to UC students in California. The plan was built for students with students actively involved in its design. UC SHIP provides high quality, affordable, and convenient coverage that protects students from unexpected healthcare costs. All UC San Diego students have access to student health and our counseling and psychological services on campus. If you are referred to an outside provider, you have to leave our campus and go outside into the community. The UC SHIP plan will cover for those services, or you will be using the plan that you waived the UC SHIP with to access specialty care benefits. We'll talk about the students that need to waive the requirement if you have another insurance on the next slides. Every registered student at the University of California is charged a health fee, and you'll be automatically enrolled in the school insurance unless you successfully opt out by filing a health fee waiver application. Students that come to student health with UC SHIP pay nothing except prescription copays. Students that have our RAFT plan have successfully waived out of the SHIP requirement and have picked up a access membership to come into the student health clinic for $70 per quarter. They pay nothing for appointments when they do come to student health, and if you need specialty care, we'll refer you outside with your own insurance. This is our waiver time frame. In order to opt out of the school insurance, you would go onto your Triton link and file a health fee waiver. You're clicking on a link on the financial tools. It says health fee waiver. It'll take you to your single sign-on where you'll file an application that takes about 5 minutes to fill out. You'll need your own insurance card and some insurance coverage information so that you can answer the questions. If you successfully waive the insurance, you'll be asked at the end of that application if you'd like to join our RAFT program, and it will give you a little bit of information about the coverage and how much that costs. A waiver must be filed timely. Our open waiver time frame is very short this year. It opens on August 3rd and will remain open until September 11th. So you need to file a waiver if you want to opt out of the insurance requirement here for this school. We don't accept late waivers, and we can't retroactivate any waivers. A waiver must be renewed each school year. The best time to do it is when you register for classes. You just jump over to the Triton link and file that waiver application. It'll waive you for the fall, winter, and spring, and we don't charge any insurance during the summertime. This QR code will take you to the waiver information on our website so you can find out more information. We know insurance is expensive, so we have given you a few plans that are less expensive that meet our waiver requirements. These are online health insurance plans. Please consider your health needs and contact us if you need assistance in deciding what plan is best for you. The accepted plans would be the ISO Care Plan, PSI Platinum Plan, and Student Medicover. And Bella's here to talk about that today after I'm done with my presentation. Some QR codes that will take you to our website so you can learn more about UC SHIP, the health fee waiver, the RAFT offering, and to find out more about our student health clinic on campus. Our student health clinic is comprised of more than 30 medical doctors, nurse practitioners, registered nurses. We have an X-ray unit, lab services, a pharmacy, an urgent care, optometry services. We provide vaccinations and immunizations. We do travel record review and a lot more. Please visit our website to get further details. And know that 52% of our student population on campus keep the UC SHIP plan, and their primary care doctors are housed at Student Health. This makes getting care easy and is far less expensive than going out into the community for care. We charge about a third of what the community providers charge. The Student Health Clinic is open 8 a.m. to 4 p.m. most days except Monday, when we stay open a little bit later until 6 p.m. And on Saturdays, our urgent care is open from 9 to 12 p.m. We have a nurse advice line for any healthcare questions after we close. Anyone can call our number to get advice from a registered nurse. To make appointments at our clinic, please use the My Student chart or call us at the number provided. This is a picture of our office found on Library Walk, centrally located on campus. We will be moving to the true center of campus in July, and we'll have a brand new clinic with state-of-the-art functionalities. In an effort to be ecologically minded, the insurance plan does not mail out insurance cards. Your insurance card, if you choose to be covered by the UC SHIP, is found on an app. The app is Sydney Health, SYDNEY. Download the app to your phone and you'll find that you have access to locate providers in the community, look up and review claims payments, and the front and the back of your insurance card will be on this app. The app will be effective after the first day of coverage this school year, and that'll be September 21st, 2026. The UC SHIP insurance is underwritten by Anthem Blue Cross, participating provider organization. Anthem Blue Cross has one of the largest networks in the United States, serving nearly 41 million members, and in California alone, its network includes over 100,000 doctors and over 400 hospitals. The network also includes out-of-country coverage under the Blue Card program, so take that trip or go home for your break and you know you have coverage. This is a student division offering only for the University of California enrollees. This plan is considered a Platinum Plus plan under the eyes of the University of California Commission of Health Insurance. Depending on what tier of coverage you would like to use, you can determine how much you'll pay for those services. There are 3 tiers of coverage, the UC and Anthem tiers covering the most. Anthem Blue Cross PPO is a global coverage with access to it that works far beyond the student health clinic on our campus. If you're seen at Student Health on campus and receive a referral to access care at a specialist office, you get to choose where you will be seen. The first tier is the least expensive, and that would be our University of California providers. Using UC providers and facilities will save the student some of the out-of-pocket expenses. There isn't a deductible under this tier, and we have 300 specialists in 4 acute University of California hospitals in the surrounding neighborhood and San Diego. With growth happening every day, the copays to see a specialist are $10 and $5 to see a mental health provider. Under the Anthem network, using the second tier of benefits, that means that you're not going to a University of California provider or facility, but you're seeking care at an Anthem Blue Cross provider that's contracted. You can find providers by calling Anthem at the 1-866 number or by using the app on the Sydney Health app to find a provider under anthem.com. This requires a $500 deductible for hospital-based services like x-rays or lab services, or if you're hospitalized, and there's a $20 copay to see a specialist under this tier. Most commonly used when students are traveling for school or outside of California to go home for a break. The last tier is our out-of-network tier, and this means that you're using a provider that doesn't work with the University of California and doesn't hold a contract with Anthem Blue Cross. This is the highest out-of-pocket experience under any insurance. It requires a $1,000 deductible be satisfied before Anthem will pay any further claims. After the deductible is met, you'll need to submit claims to Anthem, and they will be paid at 60% of billed charges, leaving you with 40% to pay. UC SHIP gives enrollees a supplemental curative dental plan provided by Delta Dental. Delta Dental PPO will provide UC SHIP members with $1,000 US worth of coverage for teeth evaluation and cleaning, fillings, x-rays, root canals, and tooth extraction if you utilize a Delta Dental provider. 95% of dentists in California are contracted with Delta Dental. To find a dentist, you would call Delta Dental at their 800 number or visit their website. Referrals are not necessary to access dental care. UC SHIP covers one routine eye exam per benefit year, which runs from August 1st to July 31st. And Anthem iMed will provide you with $120 to apply towards frames and lenses to contact lenses once per benefit year. To maximize your benefits, please call the UCSD Student Health Optometry Unit at the number provided, and they'll schedule you an appointment. Please call Anthem iMed at their 866 number to locate other contracted providers or if you have questions about benefits. No referral is required for optometry. On our UC campus, we are lucky enough to partner with over 50 psychological providers on our campus, all ready to assist you. Please call the phone number provided or take a look at their website to find out more information about the providers, online resources, and events happening that might be attractive to you. Services at our Counseling and Psychological Services, which we call CAPS, on campus are free to all UC students. If you would like to be referred to an outside therapist or a doctor, please contact CAPS and they'll walk you through the referral process. Now, some resources you can take advantage of if you're on campus or if you have any questions. There's lots of help here, resources for our clinic, for our CAPS program, the insurance carriers, and when you can do a face-to-face meeting with our student health insurance staff. We also hold webinars and info sessions over the summer, so please check out our website and register for anything that you might be interested in. I want to thank you for your time today, and if you see me or any of our staff on campus, please say hi. We're here to help you in any way you need us. Please join us on the social media platforms or give us a call or email us if you do have any questions. I'm going to pass this off to Bella, I believe.
Hi, hello. My name is Bella. Thank you so much to the ISEO team and for having me today. I'd like to briefly introduce an alternate options to UC SHIP. It's a comprehensive and more affordable. Oh, next slide, please. Thank you. I'd like to, it's a comprehensive and more affordable health insurance plan designed specific for international students. We have been working with UC San Diego international students since 2016. So before I move on to the next slide, I'd like to start with a small thanks to you. We will offer a free gift today for attending today. Thanks for you to attending today's sections. We're offering a free emergency care kit shipped directly to your address at no cost. So to claim it, simply just take a screenshot right now and email it to our teams from your UC San Diego email, and we will ship it to you directly. Next slide, please. So let me give you a quick background on student Medicover. Our goal is to help international students settle into life in the US more smoothly, especially when it comes to healthcare, which can be really overwhelming if you are not familiar with the systems. So we want you to feel confident seeking medical care when you need it instead of delaying help. So, well, we partner with United Healthcare, the largest health insurance provider in the US. Our plan uses UHC PPO network, give you access to the top tier care here in La Jolla, including UC San Diego Medical Center and over 1.3 million in network provider nationwide. And most of our team member are former international students, so we truly understand how confusing US healthcare can feel at the beginning. That's why we offer 24/7 multilingual support and step-by-step assistance with finding provider, filing claim, and knowing what to do in urgent situations. We specialize in helping students through the UC waiver process every year. Last year alone, we have support over 1,200 US UC San Diego students, helping them saving thousands of dollars. So let me briefly walk you through our insurance plan. Compared to UC SHIP, one of our biggest advantage is the pricing flexibility. If you are under 27, our plan start as low as around 300 per quarter. So many students tell us they don't want to overpay, but they also don't want to take the risk. So that's why we offer multiple plan level, including options with zero deductible or low deductible plan, so that you can choose what best you budget and your house need. Even at a lower cost, you can get access to the United Healthcare PPO network as well as UC San Diego Student Health Centers. So just echo back to Jill mentioned before, the UC waiver deadline is September 11th. So just make sure you can mark your calendar and don't wait until the last minute to find us to get to know more about our plan. And we have 24/7 customer service teams to guide you through every step. Thank you today for the time. So I will hand back to the ISU team later.
Thank you so much, Bella and Student Medicover, for being a great partner and sponsor and talking about alternatives for health insurance. Next, I will be sharing about some ways that our students can engage with our community during your time at UC San Diego. You can go to iprograms.ucsd.edu for our signature programs, or iPrograms are typically offered monthly. They're recurring events that offer touch points for our international community to connect and engage with one another. So if you're curious to learn more about these programs, you can visit iprograms.ucsd.edu. We have a wonderful global coffee hour that's monthly, English in Action, English Conversation program, Triton Trekkers, where we partner with Outback Adventures, and you can explore our beautiful backyard of San Diego. ISEC, our International Student Advisory Council, is a wonderful opportunity to gain leadership experience and share about your international student experience. We have a monthly game night and crafting events where you can meet other international students, community members, and our scholars and their family members as well. Our iEvents calendar has a lot of great events sponsored not just by ISEO, but our campus community, where they have a global theme where you can learn more about the different events on campus. And many of our students will go to this website and look at events that they're interested in for the week or for the weekend. Our GAP program, the Global Ambassadors Program, is a summer-long peer mentoring program designed to assist incoming undergraduate, international, and out-of-state students in acclimating to a new environment and making a smooth transition into university life at UC San Diego. So GAP mentors are continuing students that provide friendly support in order to engage our undergraduate non-resident students and help them create a solid foundation and relationships here at our campus. So if you're interested, you can go to our website, gap.ucsd.edu. Some of our guides that I want to highlight is our welcome guide. It has information on what steps you should take before you start your classes, what to do when you're preparing for your arrival, and then the next steps upon your arrival. So you can go to our isco.ucsd.edu programs guides for more information. So our Surf Check Guide also was created by students covering the most frequently asked questions for international students. This includes topics covered like housing, arranging transportation from the airport to campus, and setting up a phone account and bank account, and so much more. So you can go to our Surf Check Guide for more information. So if you're curious about what life looks like as an international student at UC San Diego, you can follow us on Instagram, where we offer snapshots into the daily life of our students and feature places on campus, where to study, where to grab a cup of coffee, and just different recommendations from our students. So now we'll go over some additional resources and information before we wrap up today's webinar. So now note that you can start requesting your I-20 or DS 2019 when you're able to access the website. In about mid-April or so, housing should be sending out information where you can apply for on-campus housing. And then the deadline for first-year students and transfer students is June 7th. In July, as mentioned, the deadlines for health immunization requirements and the completion of the OPHD training is due. And then September, tuition will be due, move in, check in, your new international student orientation, and we look forward to welcoming you to UC San Diego. And then a few of our upcoming webinars, and this week is on finances and student accounts. April 21st, student life and getting involved. April 23rd, campus safety. April 28th, getting set up in the US and our Surf Check Live. And then May 5th, the CVIS transfer process for F1 students. So again, these webinars are being recorded and they will be posted. Okay, this is our information. And I just want to open it up. Our panelists are here available. If you have any questions, please type it in the Q&A section. Or if any of the presenters would like to highlight anything from their areas that they would like to emphasize for. I don't see any questions right now.
Hi, good morning.
Good morning.
My name is May, and I do work with Jill at Student Health Insurance. I do have a great question for waiving. And so I do have a question about if a student plans on waiving UC SHIP and they want to continue specialty care, but at UCSD Health, how would the student go about getting the referrals that are needed to be seen at UCSD Health?
Yes, actually, if they are student using student Medicover, they still can get to student centers to see the primary care. However, if they do think that they need immediate attentions using the specialty service, they actually can go to UC San Diego website to find a doctor directly and maybe call them to make appointment, because United Health, we are using the United Healthcare PPO network. So most doctor in the UC Medical Center, they can directly billing to the United Healthcare. So in that way, most students doesn't need a referral from student centers. They can seeking the specialty directly.
I see. Well, but when anyone wants to schedule an appointment at UCSD Health, specialty or primary care, they do require a referral.
Okay.
And so students who successfully waive out of UC SHIP, if they have this specific plan, if they waive out of UC SHIP, they would be considered fee for service. So does that mean that the student has to pay everything in full to be seen at Student Health to obtain a referral?
Oh, no. For the referral process, they like they're using the UC SHIP. We will recommend students go to student health centers, and then after that, if they got a referral, they can go to the specialty, and then the specialty will bill the insurance in directly with the cost that it was supposed to doing the copay or something according to the plan.
Oh, okay. Because from my understanding, United Healthcare with student Medicover is not accepted at student health yet. And so that would just mean the students would have to pay out of pocket if they waived out of SHIP, because SHIP and United Healthcare PPO is what's allowed at student health currently. But I do think this information is great, and I hope to connect with you
Okay.
after this.
Yeah, sure. Yeah, we can figure out how the billing things are going, because we are using United Healthcare PPO right now, and then it looks like there should not be problem with like direct billing.
Oh, okay. Thank you. So, but if a student who has student Medicover that needs further assistance, would we be able to refer them back to you and your team?
Yes, that would be great.
Okay. Thank you, Bella.
Mm-hmm.
Thank you, Marie.
Any other questions, or if any of the panelists would like to highlight and share information to emphasize deadlines with our attendees?
Sure, Marie. I just wanted to reinforce those students that want to keep the school insurance that's offered by UC San Diego. You don't have to act. You'll be automatically enrolled in the plan. And again, it is a comprehensive plan that covers you for primary care as well as hospital-based services. Here in the United States, if you get sick or you want to take care of a preventative service, you would go to a primary care physician office first, and that doctor would refer you to a hospital for further services if needed. If you have an urgent or an emergency, then you would go directly to a hospital to access care. But here we try to keep costs low by having the student health clinic available to you, and you're able to walk to it if you are living on campus. We have our hospitals available to you, and they're again within walking distance of the campus if you're able to do that. If not, there's shuttles and buses that go over to the hospital area. And if you do receive a referral for hospital-based services, we're generally going to send you to the UC San Diego hospitals, which you can find online and take a look at the services that they have available, see what insurances they accept, and then you can find out what your financial responsibility is in that. If you do decide that you want to waive the school insurance, please act timely on your Triton link between August 3rd and September 11th. One of those plans that is successful in waiving the school is the Student Medicover plan. But if you do use Student Medicover and you come to Student Health, you will be paying for the entire visit and seeking reimbursement back from the insurance after the fact. So I just wanted to clarify that.
Anyone else want to highlight or share anything before we close out? I only saw the one question that was answered about filling out waiver to use student Medicover instead of USHIP. Any other questions?
I would like to answer the questions on the chat right now. The question is, will we be getting complete reimbursement from student Medicover if they go to the United Health, if they go to the student center? We at this point, if you go to student centers, we will be reimburse you. You will be paying no copay and deductible. So any service that's occurred, it will be reimbursed in you using according to the plan. If you are choosing a 90% plan, you will be only paying the 10% of the out-of-pocket payment. That's the answer to the questions. So no copay, no deductible. We will directly reimburse you according to the co-insurance.
That's all the questions for today. I want to take the time to thank our partners. Thank you for our panelists for sharing today, about student health insurance and the vaccination immunization requirements. I hope everyone has a wonderful rest of your day, and we look forward to welcoming you to UC San Diego soon. Thank you, everyone. You have a
Thank
wonderful
you.
day.
Thank you.
Take care.
Bye bye.
Thank you. Bye-bye.
Bye bye.